My name is Richard Carvajal at Memorial Sloan-Kettering. I work on the Melanoma and Sarcoma Service. I'm also the Associate Director of Developmental Therapeutics here. So it's very important when I see a patient diagnosed with a rare cancer for which general oncologists might see one or two of in their entire careers, that I spend a lot of time trying to teach the patient and the family about what exactly their disease is, how it came about, what the treatment options are, and discuss how together we feel the best path forward is. Patients with uncommon cancers come here because we see large numbers of those patients. And we have large teams of, again, physicians and laboratory scientists who focus on these diseases. So for instance, for ocular melanoma, we have ophthalmologists who focus primarily on seeing patients with ocular melanoma, radiation oncologists who focus primarily on this disease. We have a laboratory program just for uveal melanoma, and then we have a series of clinical trials that I run together with other members of our service specifically for these patients. If we look just in the field of melanoma, when I started, there were no effective therapies for patients with advanced disease. There were treatments that we could try, and that could work in uncommon situations, but now with these novel therapies, whether they be small molecules targeting specific genetic subsets of melanoma, these new immunotherapies, we're seeing unbelievable outcomes where we're actually able to cure patients with advanced disease, and this was not something that we were really able to do before. And this is just over the past 5 to 10 years. This whole developmental therapeutics program is really personalized medicine, where across the board we're getting a broad genetic profile of the patient's tumor to try to really match the best therapy for that patient. And this whole phase 1 program is really doing just that. It's trying to bring the newest, the most promising therapy to patients who we really believe will benefit from these treatments. We have rewritten how we think about treating patients with melanoma, and that work in a very large part has come from this center. You know, there are a lot of gratifying parts of this job. And certainly the reason why all of us got into this is to help patients, to make patients feel better, to fight the cancer. And when we try some of these new therapies, whether it be on a phase 1 or phase 2 trial, that, you know, based on the biology, based on the laboratory work that we've done, we would predict would work, to see that actually work in people, that is one of the most unbelievable feelings, I think, for us, for the patients, to see their reaction. To see them be able to live their life, you know, enjoy time with their friends and family, do the things they want to do because of the effects that some of these new treatments have had, that's an incredible experience.